What can the color of your poop tell you about your GI health? We've got my kid's box of crayons and we're going to discuss the 50 shades of GI bleeding, starting with the color red. Unless you're the Kool-Aid man, red poop is never a good sign. It suggests blood, and bright red colors suggest that that's probably coming from near your anus. Very common reasons to have red blood from the anus are anal fissures and hemorrhoids. If you feel like you're pooping out a hot pepper, that's probably an anal fissure. If your toilet's your favorite spot to binge stream The Mandalorian and when you go to wipe you have red blood, that's probably hemorrhoids. If you're young and otherwise healthy and think that you may have anal fissures or hemorrhoids, it's reasonable to start with some lifestyle changes. Make sure you have a high fiber diet. Let's separate out the binge streaming from the potty time and try some over-the-counter hemorrhoid treatments. But if that doesn't work after 2 weeks and you're still having red blood, then this is a very concerning sign. And if you're of the age to have a colonoscopy, I would encourage that you go to a doctor sooner than later. Rarely an anal fissure or hemorrhoid can be a very large bleed, and obviously that's concerning. But even a small bleed can be a subtle sign that there's a big problem brewing in the rectum, a large polyp, or even a tumor. Patients with these problems will often present with a sense of urgency because blood is seeping out from that growth and filling the rectum with blood. And that gives the sense that they need to go and have a bowel movement. But when they move their bowels, they end up only having blood and there's no stool. And that's a highly concerning sign that I would encourage you to go to the doctor for promptly. What about these deeper shades of red? Maroon stool suggests blood that's coming from higher up in the GI tract. Somebody may have a vessel that's bleeding. They could have an infection or inflammation, or it can be caused from a tumor. In these cases, a person needs to get stool studies to evaluate for an infection, look for inflammatory cells, and then a colonoscopy so we can find the actual source of bleeding and biopsy anything that's concerning or stop a bleeding blood vessel. We're sometimes asked about some pretty nuanced colors of stool. For example, rust colors. And like a painter would mix brown and red together to form rust, I think of it the same way. But this is stool with mixed in blood. We need to take a similar approach as we would if this was maroon stool. We got to be checking labs, making sure that the person's blood levels are not too low, and seeing if we can find a source through stool studies of an infection and likely do a colonoscopy to find the source of this bleeding. As a GI doctor, there's some inappropriate conversations in our household. So it's not a surprise that my 5-year-old daughter likes to ask about colors of poop, and of course she's particularly interested in pink poop. Well, that does happen in a sense if a person has a lot of inflammation and mucus and that's intermixed with blood. I've had patients report that their poop almost looks pink. And that does particularly make me think that this person may have an infection or they may have an inflammatory bowel disease. And the approach is again going to be pretty similar. We're going to look for a source of an infection and we're going to think very strongly about doing a colonoscopy to see if there's a lot of injury to the lining of the colon that we would biopsy and diagnose. Red is a very obvious shade of stool to raise concern that a person has bleeding, but so is black. Black stool represents digested blood. Blood is broken down by our GI tract and the gut bacteria, and the result is something called melena. And not only is that black and sticky like road tar, it has a very horrible smell. So if you thought a salad digested smelled bad, imagine blood rancid. People will often notice it by its smell alone, and it's very different from other causes of black stool, such as iron supplements or the bismuth and Pepto-Bismol, or if you've eaten a lot of blackberries, blueberries, or even red beets. People's diets may also include blood, like duck blood soup from Poland or morcilla from Spain. So while there's these other reasons that a person's stool could be black, we're most often concerned that this person is having an upper GI bleed, particularly from their stomach or the first parts of their small bowel. And that's because bleeding from these locations has ample time to be digested to form melena. However, that can actually happen even if a person is having a bleed in their colon from a tumor, because it can take quite a bit of time for that blood to travel through the colon before it's expelled. And so black stool does not exclusively mean that this person is having a bleeding ulcer in their stomach. We have to be thinking about the entire GI tract really, but we usually start evaluating this by doing an upper endoscopy to look into the stomach and the first parts of the small bowel. This has been a playful take on a serious subject of GI bleeding. So if you have concerns, please take them to your GI provider. I hope you found this information helpful. Appreciate your time. Be safe.